I love a good intro song. Hi, everyone. I'm Cassie DeWalt. My pronouns are she, her, and I'm joining you from St. Louis, Missouri. I'm a board member of OutCare Health, and I'm thrilled to welcome you to this Out Talk series where we focus on diversity and intersectionality within the LGBTQ plus community. We're excited to have participants from all around the world today, and I want to emphasize that this is a safe and welcoming place for everyone. Please feel free to ask any questions in the chat throughout the sessions. Just type them into the chat or submitting them in the Q&A section. All Out Talks are recorded and will be available on our website starting next week. I'm particularly looking forward to today's discussion, Beyond the Binary, Affirming Intersex Communities in a Gendered World. We have an incredible panel lined up with inspiring individuals doing amazing things around the world. So a special thank you to our moderator, John. And so I will pass it off to you. So you can take it away, please. Thanks.
Yay, thank you so much, Cassie. And it's great seeing you as always. And I'm looking in the chat. We did a little welcome thing. We got people from Boston, from Washington, from Arizona. We got people all over the place joining us today. Montana, welcome, Montana. I want to thank you all for joining us today. It's so cool to have this conversation. And I'm so excited to have this group of panelists, some of who have been with us before, some were brand new to us, to have this really beautiful in-depth conversation about really looking at intersex communities and, you know, how they move through the very gendered world that we all live in. I want to start by introducing our panelists. Actually, we're going to have them introduce themselves. I think it's more fun that way. So they're going to share a little bit of who they are, the work that they do, and they're getting a bonus surprise question that they are hearing right now for the very first time. And that question is, what is at the top of your streaming queue right now? What are you watching? Streaming online. Okay. So with that said, Erica, why don't we start with you today and welcome, say hello.
Thank you so much, John. Hi, I'm Erica Lorschbaugh. I am the Executive Director of Interact, Advocates for Intersex Youth. I'm an intersex person. I identify as non-binary and genderqueer. I am a civil rights lawyer, though I try not to identify too hard with being a lawyer. Yeah, I've done a ton of different work in my legal career. Before that, I was a community organizer for a long time, but I've done a lot of work in the area of gender and sexuality law. And the thing I've been watching is Homeland. I never watched it when it was a thing, so I'd always heard good stuff, and now I'm into the second season of it.
Cool, thank you so much. Georgianne, take it away.
Hi, everyone. My name is Georgianne Davis. I am an associate professor of sociology at the University of New Mexico. I've been studying the way in which intersex is experienced and contested for about 15 years. I'm also an intersex person, and it's really exciting to be here and to be able to talk to folks openly about the ways in which intersex is, as I said, experienced and contested, not just from an academic knowledge perspective, but also from my own. So kind of bridging my personal experiences with my professional interest in understanding inequalities around gender and medicine and so on and so forth. And what's on the top of my streaming these days, I don't know, I have a 4-year-old and 2-year-old, so there's really not much. I would say maybe, I don't know, some Halloween Coco Melon special. I'm not really sure. It's certainly not mine. But they always are on that and taking it from me and I'll do whatever I can to keep them quiet at times. So I'm really excited to be sharing the space with people that I admire and respect. And thank you to all for being here to learn more about intersex.
And Georgianne, I just have to say, you and we got to talk about hair products after we're done today, because I like that hair and I love doing the same thing. Hey, Bria, it's so good to see you. Share a little about who you are, the work you're doing, and what's at the top of your queue list right now.
Yeah, for sure. Thanks again. It's always a pleasure to join any event that you're moderating, John. Hi, everyone. My name is Bria. My pronouns are they and she. I work with Erica at Interact as the Director of Engagement. I'm also an intersex person. I started my intersex career out as Interact youth advocate and have had the opportunity to speak about intersex issues all over the world, really. And so it's really an honor to be here with you all today, especially as we celebrate Intersex Awareness Month this month. And I am sad to say that I just finished binge watching Madam Secretary. No one ever told me that it came out in 2016, and I feel a little bit gypped because season 6 only had 10 episodes, and so I am now rewatching Designated Survivor, like I did not watch it for the first time just a few short years ago. But yeah, I think my ADHD brain, I feel like I'm watching it for the first time. So glad to be here with you all this evening. Thanks for having us.
Yay. Thank you all for sharing. And once again, my name is John Sovak. My pronouns are he, him, and I am a queer therapist here in Pasadena, California. And I specialize in working with LGBTQIA plus youth and their families during the coming out process. And I'm the author of Out, a Parent's Guide to Supporting Your LGBTQIA plus kid through coming out and beyond. It's been an exciting journey bringing this work into the world. And I'm so honored to be able to speak with all these amazing people that have come on our program here. And what's on the top of my queue right now? We have 2 episodes left of Rings of Power second season. So it's probably going to be Friday night. We're going to get some dinner, sit in front of that TV and bang out those last 2 episodes. I'm a Lord of the Rings freak. So just, I own it. I live it. It's just part of who I am. So, I want to start off this conversation respectfully understanding that I am not intersex myself. I am not part of the community. And I want to recognize as though we're having this conversation to really hand the expertise over to our panelists. And I've encouraged them that if there is something that I have a misstep with today, that they are going to call me out on it, just to make sure that we keep everything really above board and a beautiful conversation as it moves today. The one thing that I was thinking about in coming into this conversation is LGBTQIA plus. We hear so much about LGBTQ even, and then we hit that I and we seem to stumble as a community. And I was wondering if you could maybe help our providers today, like look at that idea of finding the I in this acronym that we use. What is it that you've experienced in your personal journey? What has it like been for you traveling through this discovery of your intersex self? Erica, it's a big old smile, so I'm coming your way.
All right, that's cool. Bria knows because we work together. I am happy to talk, but I'm always trying to stay quiet so others can jump in. Um, So, I think first I just want to offer like, people may have different understandings of what intersex means. And, at Interact, we hold an expansive and inclusive definition of intersex. Basically anyone who has an innate variation in their physical sex characteristics, whether or not that is, visibly evident at birth. For a long time, people said, oh, they're born with variations in their physical sex characteristics. But a lot of the time, someone can be intersex or have an intersex trait that isn't apparent at the time of birth, but, may show up at the time that they experience puberty, which, often will happen early or late or look very different for young people with intersex variations. So, for me, I was aware that I was different when I was young. And it wasn't like I was very, very lightly medicalized. One of the reasons that I do advocacy work is because I haven't taken a lot of flack in my life for being intersex. I've had a lot of people, do the thing on the street where they cannot tell if I'm a man or a woman or what's going on. And, for a long time, I think I thought that that was about my gender. And at some point I was like, oh, it's, because of my physical traits. And so I think, other people have very different experiences, like I heard someone say recently, if you've met an intersex person, you've met one intersex person, like you haven't met them all. So, and I think as providers, it's just important to understand that intersex folks like have to do extra education and advocacy in our provider interactions, that folks have report a really high prevalence of provider discrimination and experiences that are negative. And so, like, if you are working with an intersex patient or client, like that's awesome. And I always just suggest people kind of get back to their own curiosity, not like, like, oh, this person is a medical oddity. But, people get into healthcare because they're, interested in people's humanity and in their lives. So I just encourage folks to roll with that,
I love everyone's being so polite today. Go, Bria.
Yeah, I'm happy happy to jump in. I know you wanted us to keep the mics on, but I think it's out of habit that I'm so used to turning it off. Also, I just wanted to say that I have really bad allergies, so if it looks like I'm crying, it's because of that. I'm really happy to be here with you all, I promise. And yeah, I think I'll just sort of add to what Erica was saying, especially about the point that there's no one way for an intersex person to look or to be. And you can't necessarily tell a person is intersex just by looking at them. Now, a person might have visible physiological characteristics that might make you pause or wonder or assume things about that person. For example, when we look at someone, I think we sort of automatically try to categorize them or like place them in a way that like, makes sense to us. And I think that unfortunately, what makes sense to a lot of people is a very binary way of thinking. You're either this or you are that. You are masculine or you are feminine. You are a man or you are a woman. You're male or you're female. But I think that we are realizing something that we're realizing is that um, that's as humans we don't naturally fit into these rigid categories. I like to refer to myself as a person with visible intersex traits. And what I think that means for me personally is that when people look at me, they have a hard time trying to place me in their minds. They'll see me and they'll say something like, oh, you're this. But then they'll hear me talk and say, oh, wait, no, you must be that. And so for me, I don't want to be anything other than myself. Um, so I can't tell you what an intersex person looks like, but I can tell you what this intersex person looks like. And I really believe that's the beauty in having self-determination.
Thanks for adding that. That's all great. I mean, I would just, to try to keep the conversation moving, I'll just say in terms of the I on the LGBTQ acronym or alphabet soup or whatever you want to call it, I think oftentimes it's invisible or added on is sort of just like people don't even know what they're adding on. Like they just add the I and they have very misconceptions about what intersex is. And I love that what my other panelists have been saying about like, intersex isn't a one size fits all or experience isn't one size fits all. So to just add one other dimension to this is I do think there's something, at least that I've learned from my 15 or so years involved in the intersex community, is that there is a lot of queer phobia in the intersex community too, and transphobia, et cetera. And there are people who are opposed to adding the I onto that LGBTQI acronym. And that just speaks volumes to, I think, the diversity, for lack of a better word, among people within the intersex community. So I think it would be denying people their humanity or a group of people their humanity if we don't understand that they are, just as racist, just as classist, just as transphobic, et cetera, as the rest of society, right? So I think there's that dimension too. That's not to place the onus on intersex people, but it's just to add a different dimension of why oftentimes that intersex is invisible. I've had people reach out to me, and I am queer. I'm partnered with a woman. I identify mostly as gender queer woman. I was raised as a woman. I don't know. I'm kind of like pronouns are, I'm not sure like what we do. Like we all ask pronouns here, for example, but like it's not like if I'm doing another talk and it's on something else, like they don't do pronouns. So then I have like this like sort of aversion to pronouns in general. That's just a side note. So what I think about is, I mean, I myself see the struggles that other people in that LGBTQ or just anyone under all of us, regardless of our bodies, are all sort of intersected with other sort of dimensions of inequalities, including race, gender, class, et cetera. But not everyone feels that way. So I think it's something to kind of challenge and work through. But I've had people reach out to me and be very unhappy that when the I is attached to the LGBTQ. And then we have to sort of educate why that is and how that works and how these things are related. So I think that's something that as providers to be aware of. On the flip side, I think of things that I've studied for a long time is there are people who want to hold on to this sort of medical model of what intersex is, as opposed to sort of people wanting to move beyond the medical model, which I think most of the panelists on here with me agree. But there are people that find comfort in that medical model. And I always say, I don't really care what path you choose, as long as you realize that these are like socially constructed paths, and we're on them to whatever is going to help you live a happier, healthier life, but not at the expense of other people.
And Jordan, you actually mentioned the myriad misconceptions that are out there in the world. And because most medical education, most mental health medication, most social work medication does not really include in-depth studies on working with the intersex community, what do you think some of those misconceptions are that are playing out in the world and that are affecting or influencing your personal journeys?
I mean, for me, I'll just say that I think the biggest thing that providers, in my own personal experience, is not admit their ignorance on the topic of intersex when they're seeing me. I mean, I think that takes, and maybe it's because I'm an educator and I teach, and I was just teaching a social statistics class today, and if a student asks a question I don't know, I recognize that vulnerability to say, I'm not sure of that. Like, I don't know why that formula is written that way. But I think that's what we all can do, is just say, I don't know about that, and try to get information. And I know a lot of intersex people have to do a lot of the labor when they see their medical providers and educate the doctors. I feel like this happens all the time for me, and I know for other folks too. But I think that is not necessarily the issue really at hand. I mean, it is, but I think the major issue is just when people are ignorant or reluctant to try to listen and value what the patients have to offer. So I think some of the misconceptions are about things like one size fits all, right? Like that everyone's intersex experience is exactly the same. Or I've heard such strange things, even by specialists, like that have nothing to do with it, or they just ask these very much voyeuristic questions about my body, or I mean, some more so than less so. Like they'll ask questions and it's just inappropriate. And I feel like, I mean, and I think it's okay to call that out. And I don't think this is unique to intersex. I think this happens quite a bit, but I think around all different sort of dimensions, I think we just have to look inward and say, like, well, is this really a question I'm asking to help this patient and whatever they're here to be treated for, or how I can help be a better provider, an overall provider, or offer them the services I need? Or am I just voyeuristically asking them questions that may not be relevant to the thing that they're there to be treated for? So, or to be seen for. So I think there's a lot of different dimensions, but yeah, I've heard it all, like all sorts of things. I'm sure the other panelists have more concrete examples, but I mean, I guess real quick, I'll say one person said to me, I didn't know that was real. Like they didn't know it was real. Like they were going on. And I was like, yeah, it's real. Like Greek mythology here. Like, I don't know. Like, it's just like, how do you respond to that as a patient?
Erica?
Yeah, I just think, um, the misconceptions can range from kind of, very basic, like the thing I always used to hear is like, oh, does that mean you have both? And, like I don't love to repeat that, because hearing that question can be very like, oh, for a lot of intersex folks. Um, but it's a question that comes up. And so I feel like it's worth raising. And, like I'll get scientific on people if if they ask me a question like that, and I'll be like, oh, you know, as rare as that is, it could be a thing. It depends on your definitions, and people are more likely to have, a combination of ovarian and testicular tissue than they are to have, a combination of what we think of as typically male or female genitals. And again, I was a biology nerd. I don't mind talking in those terms. And actually, I find that it's really helpful if people are trying to ask invasive questions about me and my body. I'm like, oh, let me give you the birds and the bees talk, but just, add in the birds and the bees that nobody already told you about. So, I think it's a really common misconception that trans and intersex are the same. And I think that kind of makes sense to me in a culture where we haven't historically like had separate notions of sex and gender. we're wrestling with that a lot now. And one of the reasons that I argue, just hearkening back to the prior question, one of the reasons that I argue for the inclusion of intersex and the I in the, grand rainbow umbrella, is, like, if you are to do work on intersex advocacy, you will immediately see how intersex and trans are conflated over and over again, how anti-trans measures impact intersex folks, whether or not intersex people are ever contemplated, whether or not the person drafting these laws or passing them has any idea that intersex people exist, and that is true because our struggles overlap, because there is actual overlap in our populations. And as Georgianne said, there are plenty of places where the populations do not overlap at all, and people are like resentful of the assumptions that people can make. So, there's a lot in there, and I just think I enjoy being a person that people can, like, I'll say, like, you can ask whatever question and I'll answer it. Like, I'm not squirrely about that kind of thing, but um I think just even the fact that people think intersex is so much more rare than it actually is, like, leads to people being treated as medical oddities, leads to that sense that it's like okay to ask invasive questions, and just leads to, less people actually getting their own experiences heard and less people actually hearing those experiences, fewer people. Sorry.
Yeah, and I'll just add just a really common misconception that gender and sex is dependent on and determined by the body parts that you have, and we know that that's just not true. And just to further add, I think one of the other things in referring to why the I belongs in the acronym, I think that intersex communities and the broader queer community have a common cause and really fighting for our rights to, you know, exist in society beyond these traditional binary norms. And, when you think about the ways that our trans siblings are fighting for their rights to self-determination and, all of these things that are rooted in the same sort of stigmatization and transphobia and homophobia that I think the broader queer community is still sort of grappling with today, as are intersex people. So I think it's sort of rooted in the same place.
And for those of us who are joining us live today, if you have any questions that are coming up as this conversation is proceeding, you can drop them into the chat or put them into the Q&A. I'm more likely to see it in the Q&A, just being honest about how it works for me. So if you do have some questions that are coming up for our panelists, put them into the Q&A and we'll bring them out into conversation. One of the things that I want to be respectfully aware of too is oftentimes when we're talking about intersex communities, we end up in this big discussion about medical bodies. I would like to know if you would all be okay with us moving also to the social, the emotional, the mental pieces of walking through this world. You've all, I said, I am my intersex person. That's the only one I could speak to. And I think it would be a really powerful thing to look at these other facets of what make all of us up as people and how your experience as an intersex person does affect you, both mentally, emotionally, lovingly, socially, and really look at those bigger aspects as well too. So I know that's kind of a big generalized question, but I'd just like to open up space and let's see the direction it goes as we open up here. So anybody want to take it on first?
I mean, I could just quickly say that I think for my own sort of being, I think that, I wasn't diagnosed until I was, tween, basically. And I have complete androgen insensitivity syndrome, which means outside I'm external female appearance, but inside, instead of ovaries, uterus, fallopian tubes, I had internal undescended testes, XY chromosomes, etc. And like many people, I'm 44 years old, and like many people in that generation of intersex people, I was lied to about my diagnosis. And not that that doesn't still happen, but it does. I was lied to about my diagnosis, and I didn't discover the truth until I happened, thankfully, to get my own medical records, because I'm kind of a type A personality, and I wanted it when I moved to a new medical provider. And I read through them, and like you might imagine, was just like completely shocked by everything I was reading. How do you not trust providers, or how do you ever trust a provider again after that? So from my experience, I will just say that, I mean, I did live the number of years up until I was like 18 or 19 or whatever it was when I got my hands on my records without even knowing that I had an intersex trait, whatever you want to call it, condition, disorder in quotes, which I don't like. But whatever it is, I mean, that didn't really, I didn't really see myself any differently than I was being brought up as a young person. What it did do, though, when I did get that diagnosis, is it did make me start questioning, or when I discovered my own diagnosis, started making me retrospectively question everything. And I think any of us can do that. And I think it can be kind of dangerous, honestly, like about what that means about this, or what it means about that, what this means in what direction. I think ultimately, and I appreciate wanting to move away from the medical, but I think it's really important to think about the way I felt in terms of when I saw those records. It was tied to how I was treated by medicine. So then I started thinking it was such a horrific thing that I couldn't even be told. Or even now, when I go to a provider as a 44-year-old, like middle-aged person, and I have to have a medical procedure. And I talk to them about having had those testes removed. I even do a 101 in 10 minutes to the nurse about why I don't have periods or whatever. And they're very empathetic, but then they come back to the exam room and they'll tell me, oh, we still need you to do a pregnancy test because I can't advance you, if I'm having some, like, say, pre-op surgical thing unrelated to intersex. And I say, well, for many reasons, I can't be pregnant. So, but there's still that issue. And I like to bring that up because I feel like those are sources of trauma for a lot of intersex people. So like, bringing that up to me, or it's just all around us. And I think other ways that it happens, like it intersects with transphobia, with everything, like all sorts of isms that come up, is now as a parent, like I've had a pediatrician just last week, like, doing a physical exam on my 4-year-old, and looked at his genitalia as part of the exam and said, oh, you're still a boy. Like, just those types of things just make me cringe. And he's not intersex. I mean, but it just, and I think it's just really kind of a sad, scary thing that those things happen. So, I mean, not to get away from the question, but I just think psychologically, the reaction, or how I was treated in medicine and continue to be treated in medicine, not even me personally, but like my kid, then makes you start thinking differently, and thus altering how you feel comfortable with yourself, like how you feel comfortable who you are in the body you have and the body you were born in.
I think I'll give a little bit more context for the audience about what we mean when we're talking about intersex surgeries. One of the common surgeries includes vaginoplasty. So this is where a vaginal canal is either created or lengthened. But it also typically includes feminizing the outer genital area as well, not just the canal. So it usually includes creating or changing the appearance of the labia, or reducing the size of the clitoris. And as far as I know, all of these procedures tend to be done together to feminize the genitalia, and it's known as a genitoplasty. And according to Weill Cornell's pediatric urology website, the standard of care is to perform these procedures on children, specifically with a variation known as congenital adrenal hyperplasia, which is the variation that I have. It says it on their website. I promise you, I can send you the link. These procedures are typically performed on children between the ages of 3 and 6 months. And it says there clear as day that these surgeries are typically performed on children between 3 and 6 months to make it easier for them to psychosocially adjust. So again, I have congenital adrenal hyperplasia. And from all the research I've done in my younger years, really just trying to like make sense of my body and my experience. And and a lot of the CAH specific support spaces that I've been a part of. Um, and of course, you'll get a mix of people who say that they were happy that they had surgery as a child, or you'll find a lot of parents who say that their kid is an intersex, they just have a medical condition. And I really see this as a way to compartmentalize and really separate oneself from this other thing. And while in some ways I get it, I too am more than my intersex variation. Um, but I also know that being intersex has really shaped who I am as a person. It is the root of a lot of my trauma, and it is the source of so much of the joy and the sense of community that I've been able to cultivate. And in so many ways, I honestly don't know who I'd be without this part of myself. I know we tend to focus a lot on the bad stuff and the trauma, and it's very real and it's very prevalent in our community. But there's also a lot of joy and resilience. And so I just wanted to quickly name that. So people know it's not all bad all the time. And then the other procedures that are often performed on intersex children are known as hypospadias repairs. These are procedures that extend the urethral opening to the tip of the penis so that it is in a quote unquote normal position. And quite literally, it also says on the website, again, happy to share the link, that the reasons for this treatment, if the urethral opening is too far down, for example, boys are not able to pee standing up like other boys. So similarly to why vaginoplasties are performed, it is done in order to make it easier for a child to psychosocially adjust. And this procedure is often performed before the age of 1, still at many institutions, again, as the standard of care. And gonadectomies, as Georgianne mentioned, are procedures that remove the gonads, so ovarian or testicular tissue. And of course, removing these organs prevents reproduction, and it also prevents the body from developing hormones that it would otherwise be produced in the ovaries or testes. And this can also affect the person's bone health and could require them to rely on lifelong hormone replacement therapy. And so, because many of these interventions are performed on intersex children, parental consent is required, and oftentimes that requires parents to make a lot of assumptions about what their child's eventual, for example, gender identity and their eventual sexuality might be, because infants and toddlers, again, most of these procedures are performed on children between the ages of 3 months and 1 year old, are not old enough to meaningfully participate in the conversation. And again, we're not talking about medically necessary surgeries. We're talking about surgeries where there might be societal pressures, but they are certainly not medically urgent ones. I also forgot the question. Yes.
It's all good. I'll bring us around. Erica, thoughts?
I was just thinking, again, I mentioned like I kind of lucked out because I was just permitted to grow up. Like when I was very young, I had precocious puberty, and I got very hairy. And so my mom didn't think anything of it, and my mom passed away when I was 18. I wish I could ask her, but in hindsight, I kind of think that my mom might have been built like me. Um, and um my grandma was like, oh, trying to make me a very good little lady. So she was like, okay, well, we gotta take Erica to the doctor. And so they put me on a corticosteroid. The only thing I really remember about it is that they were like, you can't eat bananas. And I was like, that's fine. I don't like bananas anyway. Um, and I think I might have taken it for about a week, and it just kind of fell off. And that was about the extent of how any of my physical differences were medicalized. And I just feel lucky. I feel lucky that I grew up in a household where like different was good. Like I was always aware of being different in numerous ways. Not just about my intersex traits, or about my queerness, which was very apparent to me when I was very young, but um I just think like the thing that makes the difference in all of our experiences is how we are supported. Like I was a psych major, I'm a restorative justice nerd. And so these things, kind of all come together in my current life. And, I happen to look in the Q&A a bit and, I won't answer the question in full, but, advocates all agree that like the thing that will make the most difference is psychosocial support. And it's not, like the kind of psychosocial support that intersex kids used to get was basically conversion therapy, like you are a boy, you are a boy, or you are a girl, you are a girl, in the guise of actual supportive therapy. Um, and when it comes to parents, the biggest risk factor for whether or not a kid is going to get operated on is not what hospital they go to or what a provider says. It's how the parents feel. And if parents can have the right kind of support, then they can be comfortable letting their kids grow up as they are. So I don't know. Emotionally and socially, I feel very lucky. I feel very like my intersexness and my identity are very woven together. And I know that it has to be in some part because I wasn't shamed about it. I didn't have to pull them apart to say like, where is this pain coming from? And so I feel really fortunate for that.
And kind of weaving a few of our questions together that are in the Q&A, what do you think are some like actual concrete things that mental health providers, doctors, nurses, front desk people could provide to create a more welcoming, affirming space that would create this kind of psychosocial support that you're describing? What are some concrete things that might help?
I think a lot of the time I think it's just the same kind of thing. Like my wife is a therapist and worked at the mental health clinic in Staten Island, not a mental health clinic. And um, you know, was one of the first providers there to just have like LGBTQ plus poster like on her wall, and it makes a difference. And it made a difference to her coworkers who were like, oh, you're open to that. And so then she ended up getting, every, queer or like gender questioning kid sent her way. Um, but that's the thing. If we had, just like some like there's a lot of really beautiful intersex art posters, people can have stuff like that. Bria's got a little intersex flag behind them, have a little even have the intersex inclusive pride flag. People will ask over and over, what's that yellow and purple? And if you can say, oh, that's intersex, then like A, you're educating people around you, B, you're just displaying like openness, um so that's like the lowest hanging fruit. And um I don't it's hard to find like CEs I know that are really intersex competent and really intersex affirming, but I think for providers, if you're able to access something like that, I super encourage that. um I think that most of the time, the things that intersex folks need aren't going to be different from what other people need, which is really just the understanding and the curiosity and the openness. But because visibility is the first barrier for intersex folks in a way that, we might think of for trans folks a generation ago, or we might think of for gay and lesbian folks a generation or two before that, like we need to see the signs that it's okay to be authentic and express ourselves authentically in those spaces.
I would just add too, like encouraging like folks to be connected with other folks. Like single-handedly, one of the most important things I've heard from intersex people over and over again is being connected with other intersex people, or parents of intersex kids being connected with other parents as they navigate these decisions. And I think, especially now as a parent myself for the last 4 or so years, it just makes sense. If you're bringing a problem or a concern, I get it. Like even before I had kids, we want, if something is told is wrong with our child, or I used to give the example of like, I go to the veterinarian and they say, something's wrong with your pet. Like I want that fixed right away. So thinking about how you might not see that as a problem and how you minimize the concern, or de-escalate the situation and think about what that parent might need is to be connected with other parents, to how to navigate those situations. So I've seen it countless times over and over again that, you know, it's not surprising parents are unaware of this. And I think it's okay to maybe reach out and have resources available. So I love the idea about the signs and the posters and the flags. Like, I think that's really welcoming. And I think also having some resources, if that does come up in your practice or your experience, like being able to refer someone to a peer support group, which can be very, very important. So like Interconnect is a really great one. And honestly, even reaching out to folks that Interact, like we are all sort of working together. Anyone, I often get emails because they see I am a sociologist and they think I'm a therapist or something, and I'll then like direct them in the right way. But just letting them know they're not alone. That's like the most important thing too. Like, so they're not navigating that in a situation that feels very isolating. And that goes back to what I said earlier, is just acknowledging, like, even if you don't have those resources right then and there, but being able to dig the resources up and offer them to that person or family or what have you.
Yeah, and I really like what Georgianne was saying at the beginning about removing intersex from this purely medicalized lens and seeing it first and foremost about human rights. And I think integrating more holistic care into your practice. Yes, as intersex people, we have very specific healthcare needs related to our intersex variations, but sometimes that becomes the only focus, and other things gets missed. Like for example, it felt like for a while, every single conversation I had with my provider was about my period. And if I was having one, if I wasn't having one, and if I was it regular? And if it wasn't, how can we make sure I have regular periods, all like so I can have babies one day, right? And so like I care more about how the medication y'all are prescribing me is making me have these terrible side effects. I could care less about having regular periods or not. And I think that like folks already said, there are small things that people can do for educating yourself first and foremost. I think Interact's website is a great place to start, but there's also so many other resources out there, books and films, um, to just have intersex people on your radar so that when opportunities to educate other people come up, you feel like you have the tools to do that, or at least point people in the right direction to get that information.
And taking off with what you were just saying, Bria, Morgan brought up a question. How can providers who maybe have group practices or working in hospital settings or community agencies, how can they be supportive to their intersex employees and providers that are on their teams to create a space that feels safe for them to do their best work?
I'll just quickly actually suggest implementing the practice of using organ inventories. And this is essentially a way for patients to basically let you know in as much detail as they can about the organs and body parts that they do have. That way, assumptions aren't being made about what the needs are by the patients or um, assumptions by their providers, and people are still able to get the healthcare that they need and the relevant information that they need about things like screenings for cervical cancer, for example, and including intersex topics as a part of the requirement for, like, I think Erica mentioned, continuing medical education is a great way to make sure providers are getting access to the information as well, because what we have learned is that from medical students is that providers are learning very little about intersex issues in medical school. So there is a huge gap there.
Yeah, and like, for any population, there basically hasn't been, it hasn't been standard for people to inquire of their patients, of their employees on an affirmative action form or whatever it might be. Like, are you intersex, And so there are now more and more different varieties of like an intersex question showing up in different spaces and different measures. And um, I think in the employment context, so I want to give a little plug. We put together like a workplace inclusion guide with Out and Equal. You can find it on the Interact website or on Out and Equal's website. Um, you know, a lot of the time there's no, I happened to come out at intersex at as intersex at my prior job, because we were talking about trans and intersex issues in the work. But generally, there's not a lot of reason for people to come out as intersex, particularly in the workplace, particularly, um, you know, with like, and this is no shade to modern sexual harassment laws, which exist for a reason. You know, they're like building codes. They're written in blood. They're written the way they are because of people's horrible experiences. Um, but like the workplace is a very treacherous place to even like talk about your intersex status unbidden, unsolicited, because just people's assumptions will be like, are you just telling me something about your genitals? I don't need to know that. Like real talk. So um in an affirmative action form, in a demographic collection form, is actually going to be the most comfortable place for a lot of intersex folks to self-identify if they wish to. Um, you know, it is almost certain that everybody on here has worked with an intersex person at some point. We are, you know, at least 2% of the population. That, you know, estimate comes from a generation ago when some intersex variations hadn't been identified yet, when the definition was not only not as expansive as it is now, but like people were very like, oh, it's just this one rare thing and this other rare thing. So probably most people have worked with an intersex person. And I think, again, just kind of, you know, being a person who is open, um, and expressing that openness, like, you know, your intersex colleague or employee may not come out to you as intersex, but they may know that they're safe with you, and that's far more important.
So we are getting close on time. I want to bring in one more question, and this is a question that Ryan brought into the Q&A. And looking at this kind of unfortunate, disastrous national movement towards trying to control access to hormone affirming treatments in the community for our trans brethren, how is this playing out in the intersex community, and is it also having an influence on the well-being and care of the intersex community?
I could go off about this, so somebody else should probably start because I'll take the full 8 minutes.
Uh, well, I think for me personally, I think that there's a lot of internalized feelings of shame, because I knew that for me personally, I knew that I was different, and I associated being different with bad or the thing you just didn't want to be. And as a young person, it honestly just didn't feel fair that I was different. I couldn't help that I was born the way that I was born, and sometimes it felt like my intersex traits was the only way that people knew me as. They didn't know anything else about me other than what I looked like. And so when I think about you know, things like the all of the anti-trans and anti-intersex bills coming up, and I think about discrimination, um, and you know, discrimination that people with intersex traits and variations in intersex characteristics face in sports and healthcare settings, and honestly anywhere. The first thing I think about is whether or not these individuals have support systems, because honestly, the reason that I am alive today is because I had one. And I won't pretend that it was easy, but to have, for example, your public medical information shared, like in the cases of Caster Semenya and Iman Khalif and many others, probably before they've even had a chance to process the information themselves, had to have been difficult. Um, because as Erica mentioned earlier, not everyone knows that they're intersex at birth. Some people don't find out until their gender is called into question, for example, like during the Olympics, and they're forced to undergo some invasive sex testing. Or in the cases of these bathroom bills, and I hate gendered restrooms. And for anybody listening, if you like to travel, Kansas City Airport has an all gender restroom, and it is very glorious. Each stall shows a green light when it's available, a red light when it's not available. I know it's not a perfect system and doesn't address every concern, but you know, people might, for me, it's better than the alternative, than the gendered restrooms, because it really gives random people you see walking around every day the ability to police you if they don't think you're using the bathroom that's in alignment with the sex you were assigned at birth. I always think about the actual real life implications of these laws and how they might affect me personally as well. So I was assigned female at birth, but I can grow a full set of facial hair, for example. And I have some other bodily features that might cause someone to clock me as male, but I am not a man. I actually love being a woman. I'm also non-binary. But on occasion, I felt pressured, for example, to use the men's restroom. And the reason I'm bringing this all up is I've gotten UTIs from holding it because I didn't feel safe going to the restroom. And I think we all know how hard it is to focus on anything else when you really have to go to the bathroom. So my well-being was absolutely affected by this experience.
I want to say that quickly that we're just now getting the first self-reported data about the impacts of enacted anti-trans laws, particularly gender-affirming care bans on intersex folks. And it blew my mind. This stuff will be coming out top of the year, but 9 out of 10 intersex folks reported that gender-affirming care bans had impacted their access to care, which was a higher number than trans folks in this survey. So, like if there's ever any doubt that anti-trans measures are gonna automatically catch up intersex folks, they are. And if you worked in reproductive or sexual health, then when we ban any type of care or we reduce access to it by taking advanced practice clinicians out of the picture, whatever it is, everybody's care gets impacted. It's not just the group you're targeting, it's everybody,
Just stepping in because we're really close on time. I always like to finish with one specific question, and it really is like taking a breath, looking ahead. What is your hope or vision for the future of intersex care and well-being as we move forward? What would be your hope, your vision for how this could move?
Oh, sorry.
You go.
I was to say most immediately, like to have more conversations like these, with more regular conversations like this. I mean, that's an immediate goal. I think that's a very low hanging fruit, as someone said earlier. Having these conversations, inviting people to come do talks at your practices and your places of employment. And as far as treating intersex employees better, I mean, pay us more. No, I'm just kidding. I mean, yeah, I do think that, but in all seriousness, I think just having these conversations so we can continue educating. And I think further is like not just educating ourselves, but trying to educate our communities, because it shouldn't all fall on the onus of intersex people to sort of educate about these intersex structures that are dangerous to us, but they also affect all of us. So we all should do the work.
I'll just say that we learn to celebrate bodily diversity.
Yeah, I feel very much the same. Like, we see a world where people get to live as they are, express themselves authentically. And that's it. That's for intersex folks, that's for endosex folks, that's for everyone. And for Intersex Awareness Day, this year we're doing #IntersexFutures. So this is a perfect question for that, John. Well done.
Well, thank you all so much for sharing your wisdom, your journey, your experience. It's really valuable for all of us to be able to create this space together today. So once again, thank you. And I'm honored to be able to sit in this space with the three of you. I also want to take a moment and recognize it is LGBTQ History Month, and this is an amazing time to really look into the history of all of our communities, honor the trailblazers who have paved the way, and continue working towards this more inclusive future that we were all just describing. Also, some really exciting news to share as we're closing up today. Outcare Health is the finalist for an Anthem Award. They're up for a Community Voice Award. This is part of that series that is that community voice. But we could use a little help for those of you who are joining us today. Please take a moment, go to outcarehealth.org/vote, and you can put your vote, have it heard, and hopefully move us up in this Community Voice Award. It would mean a lot to all of us who work with Outcare Health. And I want to invite you all to join us next month, November 21st, 3 p.m. Pacific time, 6 p.m. Eastern time, where we're continuing our Access to Care series. This time we're going to be focusing on Native, Indigenous, and Two-Spirit communities. So I hope you can all join us then. And thank you once again, all of you, for being here and sharing so openly with your hearts and your wisdom in this conversation today. Be well, everybody. Take care.